Hi, it's Dr. Rose at Deep Roots Wellness in Defiance, Ohio, and welcome to my weekly wellness video. So today I wanted to talk about mental health and some of the things that we can do holistically, biologically, physiologically to improve our mental health. And that's something that we really specialize in here at Deep Roots Wellness, is helping people who have mental health challenges, whether that be a diagnosed condition or just dealing with daily stress, or maybe even something physical that's going on that's affecting you. So we talk about these things here all the time, and I work both with clients who see our licensed psychotherapists, and I also see people from, I call them out in the wild, people who just come to see me. So if you see a therapist here at Deep Roots Wellness, they're going to cover some of these things with you probably. But if you come to see me, I make sure that we hit this very foundational approach as well, because if we don't have good mental health, we're not going to have good physical health. And if we don't have good physical health, we're not going to have good mental health. It all is tied together very closely and goes together. So first of all, I wanted to talk about, my camera. I wanted to talk about some medications that can have an effect on our mental health. And some of the major ones that have scientifically documented mental health side effects are oral and hormonal birth control. Statins are a really big one. Acid reflux medications. X-Lax is one of them, and unfortunately many medications that are intended to treat depression and anxiety and ADHD can have some negative effects on our mental health as well. And there are many other medications. In fact, I keep some books in my office, and I even keep this list, and I will show you my list. So this is a list I show my clients, and we talk about the detrimental side effects of some of the medications that are prescribed for mental health. So it's a really interesting topic, and I'm not the type of person that is against someone using medication if they need to. I'm even a user of medication, but I think it's really important to know how these medications can affect us, and the effect that they have on our body and our mineral and nutritional profiles and things like that. So this is something that's really important. If you're concerned about it, I really encourage you to talk to your pharmacist, because our pharmacists are the experts in the pharmaceuticals, and they have to spend time with you if you request it. If you're buying a prescription medication, you are entitled by law to free medication counseling. So take your pharmacist up on it and ask them what the side effects are that you should look out for, and what vitamins and minerals these medications might be depleting that you may want to supplement while you're taking your medication. Okay, so some other things that we need to worry about, and these are either things that we get from our environment or from our medications, or medications themselves, like acetaminophen can contribute to gut damage and other biological disruptions that affect your mental health. And really any of the NSAIDs like ibuprofen, naproxen, sodium, things like that. Fluoride has been shown to contribute to kind of messing with our gut health, and our neurotransmitters are manufactured in the gut, and our gut health definitely takes a toll on our mental health if it's not in really good shape. This is not just a theory. This is something that is being proven time and time again, and is definitely part of my practice, and I see a lot of really hopeful changes in people when we work on gut health. There are even some synthetic fragrances in body products, cleaning products, air fresheners, and even ingredients contained in vaccines. So we need to just be aware of what we're putting in our body and what the risks are. So ask the professional who's recommending these products to you, what are the risks, what are the benefits, what do I need to be aware of, how can I help myself prevent any kind of side effects? You know, these are important conversations that we need to be having with our health providers, especially when they're recommending a medication. And like I said, definitely take your pharmacist up on that free counseling. It's really worth it. Okay, so when we're working on our mental health, we want to make sure that we have all of our bricks of our foundation in place so that our house doesn't have weak spots. And this is something that I talk about a lot with my clients and in these videos. So I'm sure if you've watched my other videos, you're familiar with the concept of the foundations of health. So first of all, we want to eliminate processed foods as much as possible. If you like processed foods for the convenience, try to choose ones that are, they don't have refined carbs or gluten in them. Try to avoid sugar as much as possible. Check the seasonings, because there are some sneaky, weird chemicals that can be in seasonings. So just read your labels, get used to reading labels, and read the ingredients. You don't want to just read the nutrition facts, read the ingredients so we know exactly what we're putting into our bodies. The best way to avoid all these weird things is to eat whole foods as much as possible. And if you can eat organic, even better, because glyphosate, Roundup, is really detrimental to our gut health, and it's not good for our thyroids, and it has a whole host of problems. So we really want to try to eat whole foods, eat close to the earth, eat it as close to its original form as you can, safely consume it, and make sure it's the healthiest version of that whole food that you can obtain. So free-range organic eggs are great. Raw dairy, which is honestly, it's against the law in Ohio, so this is controversial, and I'm not officially recommending that because it's against the law to sell raw dairy to people. But if you read the Weston A. Price Foundation's recommendations and their research on this, there's a lot of interesting information about dairy out there. So unpasteurized dairy could be an option for you if you feel that it's safe. Wild caught fish, you know, deep water wild caught fish is a really great source of omega-3s. Sprouted and soaked nuts and seeds, fresh herbs and spices, especially garlic, ginger, and turmeric. And get your salt, people. We do not need to be on low sodium diets unless we are at risk of some sort of cardiovascular event, and our cardiovascular specialist has recommended a low sodium diet. Otherwise, we need our sodium. So get your sea salt, get your Himalayan salt. They're full of micro and macro minerals that are so important to our gut health and producing those happy, feel-good hormones and neurotransmitters. So it's really, really important. Do not avoid or restrict natural fat intake. So if you don't like eating liver, which I don't, you can take a liver supplement. You can introduce a resistant starch after about 30 days of starting to change your diet for its prebiotic qualities. You really want to avoid safflower, corn oil, canola, sunflower, and soybean oil. Those are inflammatory oils, which are really not good for our mental health. You want to use coconut and olive oil in its raw form, and then use some sort of meat oil, meat fat for cooking. At our house, we really like to use bacon grease for cooking, and there's I could do another video just on the reasons for that, but if you're interested, again, look up Weston A. Price Foundation and you'll find a lot of information about good fats versus bad fats. Okay, probiotics. So Dr. Kelly Brogan, a holistic psychiatrist, she calls them psychobiotics due to their positive psychological outcomes. So you want to supplement with a high quality, broad spectrum probiotic. The only warning I have for this is that if you really have some serious gut and digestive issues, you should be working with a health practitioner that has some experience with this, because we can actually pour fuel on the fire if we have some sort of overgrowth happening or like major dysbiosis. We need to be cautious about the probiotics. So that if you're having a lot of symptoms that have to do with gut health and, gas, bloating, indigestion, diarrhea, chronic constipation, a lot of belly pain, belching, heartburn, things like that, these are signs that you need to find somebody who can work on your gut health. Do not take the probiotics yet. Get some help first. Okay. So along with the probiotics, if your gut is in okay shape, you can do some fermented food, like kefir, kombucha, real sauerkraut, things like that, kimchi. And also we want to eat mindfully. Our digestion starts when we look at our food, when we smell our food, we salivate, we chew our food, we start to digest our food in our mouths. So eat mindfully, smell your food, look at it, slow down, chew each bite. I am the slowest eater known to anybody, all my friends and family. I'm always the last one to finish my food. And that's because I have this habit of I take small bites and I really chew up my food. And I really think that it helps my digestion a lot. And it takes me a long time to eat. And I'm sorry, but I am gonna do my job and chew my food properly. And if any of you want to join me, let's go out for dinner and we can have a nice long dinner. Okay, so supplements. This is a tricky one. I don't like to give supplement recommendations to the general public on a video because I feel like this is such a individualized approach. So there are some supplements that can really help with your mental health. I think the only one that I really feel like super safe recommending would be something like a magnesium lysine glycinate combination, or something like that. Most of us are really needing a lot more magnesium to support our enzymatic processes and our muscles and all the things. Magnesium is one of the most important minerals that we can take, and it's really depleted from our farmland. So even if we're eating the best organic produce, a lot of times it's still lacking in magnesium, and we don't produce magnesium on our own. We have to get it from our food. So that's one that I usually feel pretty confident recommending. And I really like Jigsaw products, and I really like the concentrates, trace minerals as well, if you're interested in looking for those. Okay, so other things we can do to support our mental health: meditation. So deep breathing, focusing on our breathing. Some people like to add prayer to that. People tell me all the time, I'm terrible at meditation, I hate doing it. I'll let you in on a secret. I've meditated almost every day for years, and I'm still bad at it too. I don't think it's being good at it. I think it's the practice of it. So get yourself an app with a guided meditation, do some guided breathing, listen to some positive affirmations, and let the thoughts come. The thoughts will come in and out. Just let them come in and out. It's okay. Meditation is not about making your brain go blank. So you can do this. Sleep. Maybe I should do a video on sleep hygiene. If you would like me to, please leave me a comment and a recommendation, and I'll do a video about sleep hygiene. But sleep hygiene doesn't mean having clean sheets and taking a shower before bed. There's a lot more to that. It has nothing to do with that, actually. So just making sure we have really good bedtime routine habits, and there are a lot of things we can do to improve our sleep naturally. Okay, so detoxing. To detox, some people like to take silica, some people like to do ionic foot bathing, which we do here in the office, drinking plenty of water, making sure our detoxification pathways are open so that we're taking out the garbage. and it's not sitting and fermenting. You know, if you think of like a garbage can that needs to be taken out and the flies start to come around it and it starts to get stinky, this happens in our body too. You know, I think it's a good analogy. We need to get our garbage out. So we need to be going to the bathroom regularly, number one, and number two, and drinking lots of water. So if that is not happening for you, again, I really recommend that you see somebody about that and fix the root cause of this, because that's going to really improve your health in a very impactful way, very big way. Okay, enemas. I love enemas. I love colonics. If you want to know information about this, there's a lot of good information on the internet. I can share my experience with you if you would like to. If you'd like a recommendation for somebody to see for that, I've got that too. Just let me know. And then Epsom salt baths are really relaxing. It's a great source of magnesium, and it goes transdermally or through your skin, and it helps to clear toxins, and it's very relaxing. So if you have trouble sleeping at night, or you feel really, really stressed out from all this holiday chaos that's going on right now, get yourself some plain Epsom salt. Not this kind with fragrances in it, because that's adding to your toxic load, but just some plain Epsom salt. You can add a couple of drops of essential oils to it if you wish. Be careful, make sure you know what you're doing with that, but it's a very good way to support your mental health. There are other modalities that are also helpful, like giving yourself Reiki, seeing a Reiki practitioner, which I do here at the office. One of our psychotherapists here is certified in emotional freedom techniques, or EFT tapping. So, you know, like the tapping on different places on your face and your body, and doing some talk therapy with that. And there's so many more different things. I mean, this video, I'm almost at 17 minutes here, so I'm gonna stop. But those are some of my big hitters. So if you want to work on your mental health and you want to do something that's going to make a difference, rewatch this video again, take some notes, and try some of these things. And if you do, let me know if they worked for you. I'm really curious to hear about people's successes, and also about the things that they've tried and haven't worked, and why you think that might be, that some things have worked for you and why they haven't. So if you would like any extra help, if you need to see a professional, I'm always available. You can call us at 419-239-2113, press 0, and leave a message for Bailey, and she will get you scheduled and set up as a new client, or follow up if you're one of my clients now and it's been a while and you need a tune-up. Come and see me. I'm getting pretty booked up through January, so also if you have any health goals that you're setting for the new year, now is a good time to get on my schedule, so that you can start working on your goals when you want to start working on them and not have to wait on me. So, okay, well, that's it for today. I just want to say these videos are never meant to diagnose or treat anything. That's not what I do. I support health, I balance health, and I love encouraging people. So everybody have a really wonderful Christmas. Have a happy new year, and I will see you next year in 2022. Can you believe it? It's so weird. All right. Thank you for watching.